One of the problems we've had is we used to rely a lot on international donors and the international community. And there came a time a couple years ago when they all dropped out. So we were kind of left without anybody. And it was around that time, this was 2017, when the Aurora Prize came along. So since then, we've had to rely on Aurora for a lot of help and some friends. We have some small partners, African Mission Healthcare, Catholic Medical Mission Board, and certain friends that have been able to go out and raise money for us. So it's been really a lot of private individuals, and the biggest organization has been Aurora that's helped us out. But for the most part, it's been private individuals that have really seen us through the past couple of years. Our condition in Nuba since June 2011 is we're in a state of civil war against the government in Khartoum, and we live in rebel-controlled territory, is where the hospital is. So we don't have any support from the government. The government is actually, for many years, was actively was actively attacking us. So bombing the hospital twice. They tried to take over the hospital, and the rebel soldiers have been able to repel them. So we've not gotten any assistance from the government. That might change. They're in negotiations now with the Nuba rebels, and we hope there'll be a peaceful resolution to the conflict, but we're not sure what's going to happen. The biggest challenge is always logistics, I think, over and above everything. So we're very remote. We don't get any assistance from the government. We don't get any assistance from the international community for the most part. That's not totally true. We get a little bit of stuff here and there, but for the most part, we don't get much in the way of assistance. So the biggest problem for us is how do we move things from Kenya, where we have to buy things, up to our area, which is very remote and has been an active war zone for quite a long time. I think a lot of discussions take place at a very high level, at a level of people that are in the administrative realm. They're kind of in places outside, away from the front lines where the problems are. And I think this has led to a little more of a top-down approach. There's an effort, and I think there's awareness that has to be changed. And I think all the conferences that are held, these international conferences like World Health Summit or other ones, they should always make an effort on all the panel discussions, whatever discussion is going on, always include people that are frontline workers, just to get that perspective. I think people get in their little boxes, and if you just stay in your own lane and don't look outside and see other ways you can cooperate, you're doomed to failure. So I think it's very important to include whatever you do, make sure you break down the silo and see what else is out there and find ways to cooperate with other people. If you're in health, look at people doing education, other things, and how do you cooperate with them? Because everybody is, in reality, everybody is linked together, whether you're at the ground level or at a higher level. We're all linked together, and we need everybody's cooperation to get things done.